Today I'm going to talk to you about sudden illnesses. One of them is the heart attack, and that happens when the blood vessels that transmit the blood and oxygen to the heart muscle get blocked, and that could be caused by normally it's high cholesterol, the plaque that forms in the arteries, and the other illness that can happen suddenly is a stroke. That is also when the blood stops going through the vessels and it stops from getting oxygen to the brain. Um, there are several sudden illnesses. Another one could be the asthma. Asthma is when the asthma is when the airways get inflamed, and that makes very difficult, and it's full of mucus. It's very difficult for a person to breathe. And the other illness could be seizures. Seizures can be different. There are different kinds of seizures. The most common is the grand mal seizure, where the person has the full body convulsion, and another illness that we can have suddenly is fainting. Fainting, it happens for no reason sometimes, or some medical reason, but we can't really see it. We need, on all of these sudden illnesses, what we need to do, especially when the person is having a stroke, is that we need to ask if the person can raise their arms, and if the person is with one arm just kind of hanging and the other one straight, that might be a sign of a stroke. Also, you need to ask the person if they can smile for you, and or if they can speak. A lot of times they have trouble talking, so that's probably one of the signs too. It's actually one of the signs of a stroke. Do not let the person move. Just help them sit down and have them kind of lean a little bit forward. And if you can raise their legs, and if there's no pain, they can raise their legs a little bit. Just try to make the person comfortable. And in any of those cases, we need to call 911 right away, because we don't know if the person is having a heart attack, a stroke, or or faint, or even the diabetic emergencies. There are two types of diabetics, and one of them is hypoglycemic and hyperglycemic. A lot of times it's very difficult to distinguish which one is which. In either case, what we can do is to give the person some glucose or glucose tablets to help them. The glucose is not going to hurt them, and also call 911 right away. If the person has an ID tag for medical reasons, then you make sure you check for that, look for it. If the person is responsive, also ask if they are taking any kind of medications, whether it's for heart condition or diabetes, high blood pressure. Make sure that they ask if they have taken the medicine or not. If the person is diabetic, also ask them if they ate. And if not, just try to give them a little bit of fluids. Only when the person is responsive. If the person is unresponsive, then if you check for breathing, you see they're not breathing, of course you start CPR right away, and then call 911. And that's it. Thank you.